My name is Luana Scales, and I'm co-chair of the DEI Council at Child Guidance Resource Centers. And good evening to everyone, and welcome to our council's Neighborhood Safety Solutions Initiative. We thank all of you who are joining us this evening for this very important topic on healing racial trauma. Where do we begin? We would like to know who is in our sessions this evening, and if you can, please indicate your name, organization, and email address in the chat. Also, if you have any comments or questions for our panelists, please put them in the chat box as well. And if we have some time at the end, we hope to be able to address them with our panelists at the end of the presentation. This evening, we have 5 special guests who will be sharing their views on this topic. Our panelists are State Representative Gina H. Curry, Judge Cheryl McCabe-Stroman, Reverend Carolyn C. Cavanis, Kimberly Arnold, Assistant Professor, and Davida J. Graham, who is a nurse and oversees Nurses United for Change and Equity. I want to start with State Representative Gina Curry for our first question. Please share your views regarding racial trauma.
So I just want to start out by saying good evening to everyone who has been able to get onto this important discussion tonight. Just to give you a little bit of background about myself, I know I have that title in front of my name, but before I got there, I was a fierce fighter for equity and racial equity. I have a small business called Coach Your Vision, and during COVID, worked very diligently to work with small business and organizations around DEI efforts and particularly racial justice. So when you ask me about racial trauma, first of all, when we think about trauma in itself, trauma comes from very many different roots in our lives. Can start way back from before we were even born. And when we put race to that, it brings about another whole component. And so when we have trauma, and I know because I've worked a lot with young people, children around trauma-informed care, and working on policy and to bringing that in to place in the school district where I live, I know that racial trauma deals, and I can say racial trauma really never goes away. It's deep-seated, it's rooted. I know we're having a discussion about how we can heal it, and that's a very good thing to do. But unfortunately, racial trauma is so deep-seated that we have to begin to figure out where it comes from. So we have to begin to figure out the origins of racial trauma. And then once we can look at the origins, which for some of us on the line were back when slavery began. So we weren't even here, but that racial trauma reaches all the way back. And the resonance of the traumatic incidences that happened through slavery still live with us today. Enslavement has put racial trauma at the top of the list for many of us. And those of us who don't walk around in Black or brown skin are still racially traumatized in their own way. And in many ways, trying to figure out how not to be considered racist. So these are the things that go on in our society right now. But before I end my piece of it, I just want to give a few points on how we can really look at that trauma. And one is knowing your racial identity. That is the number one piece. If you don't know who you are in your racial identity, and we have all these great places now where we can find out, you can put your blood sample in, they can find out where you are. But racial identity comes with exploring who you are through race. That's number one. And then number two is exploring your internalized racism. Really seeing how your belief systems around race and racism are yours, what you own, and what you develop and identify with. And those, I'll just give you those two, and I'll let Luana go back to the others, because, you know, since I'm a coach and a teacher and a trainer in this, I could probably do a whole session on it tonight, but I wanted to give you those two first: knowing your racial identity and exploring your internalized racism, which means identifying your belief systems around race and racism.
Ina, careful or we will have you for a full session.
Okay, thank you. Judge Stroman, can you share your views regarding racial trauma?
My name is Cheryl McCabe Stroman. I'm a judge in the state of Delaware. Delaware is a very interesting state in that it's probably one of the most racist states, and you experience a lot of racism from the flying of the Confederate flags to other behaviors that indicate racism is alive and well within the state of Delaware. It manifests itself, especially, I primarily work in the truancy court as well as civil court and landlord-tenant court. I see so the racism and trauma from it manifests itself in terms of the children, and they're not appearing, their parents not appearing for court because they don't feel they have an opportunity to be heard. The landlord-tenant court, you see it, and most of the landlords are not African-American or not minorities. And so they feel beaten before they even open their mouths. They subject themselves to conditions that you would argue a dog should not live in. But they're so afraid of the circumstances in which they find themselves, they don't feel they have the strength to fight it. And so it's quite pervasive in all generations. And unfortunately, it's cyclical and it continues generation after generation after generation. So there still needs to be a lot of work done in terms of helping, especially young people, recognize they have strength within themselves, and helping them learn that they're much more rather than their skin color.
Okay, Davida, same question. Share your views regarding racial trauma.
So co-sign what State Rep and Judge said, both of them. My name is Davida Graham. I'm actually a nurse practitioner. I have a master's degree in public health, and my specialty is community health and primary care. So racial trauma, in my opinion, when I speak of it medically, I look at it in this country as an endemic. It affects us all. As State Rep stated, that's that generational trauma. That's the word we use for it. It goes back 400 years worth. And when I look at seeing patients in primary care, you know, it's twofold. We have personalized racial trauma that we may experience on jobs or, you know, in day-to-day life, sometimes looking at the news, you know, seeing people being shot and killed by police officers, that creates a trauma, as well as the generational trauma. So I also see it a lot in healthcare because it's a mistrust in healthcare that comes back from generations. So, you know, a lot of light was shed on it during the pandemic with vaccine mistrust, but as a provider for a long time, I've been seeing this with, you know, not following up, not having trust in your medical provider. So I agree that these hard conversations need to be had to acknowledge the problem, hear people out about how they experience trauma, and really listen to it, really absorb it. As well as have these hard conversations, because this is where the growing and the change takes place.
Okay, Ms. Arnold, same question.
Good evening, everyone. I first want to just greet everyone and just say thank you to the Child Guidance Resource Centers for hosting this important conversation and inviting us all to participate. I think that this is a topic that definitely should be discussed across multiple sectors. And I'm happy to see that these conversations are happening a lot more than they used to And I think that that can lead to real change as long as we are all having that same goal of addressing racial trauma, healing from it, and really figuring out ways to bring everyone to the table to figure out sustainable solutions. So I'm currently an assistant professor of family medicine and community health at the University of Pennsylvania Perelman School of Medicine. All of my background and training is in public health, so I'm very passionate about disease prevention, health promotion, and really working across various sectors to address health disparities, especially disparities that are disproportionately experienced by Black people, and really also addressing inequities and social determinants of health, which are the conditions in which we are born, live, grow, pray, play, all of that. So a lot of times when people think about health, they immediately think of the healthcare system, in which our healthcare system in the United States is not designed for health promotion or for wellness. Is more of a sick care system, as opposed to really addressing the root causes of disease, which in America are very much linked to racism. And so anytime that I talk about health disparities, you can't talk about health disparities without talking about racism and discrimination and racial trauma and all of those things, because there are direct links to current conditions that we're seeing with the mental health of Black Americans, as well as physical health. So there is a historical trauma theory that touches on some of the things that the panelists have already mentioned around how historical trauma that occurred generations before, we were even born, and many things that our ancestors went through in coming over to America from their kingdoms in Africa, and having to go through just the stripping away really of a lot of our cultural practices and traditions, as well as the psychological slavery that they were in addition to the physical conditions. All of that still has impacts on health disparities today. And we have numerous studies that document how racism is connected to hypertension, how it's connected to various forms of cancer, how it's connected to depression, anxiety, PTSD. So there are numerous conditions that are linked to racism, in addition to the social conditions in terms of differences in income and employment, and housing conditions, neighborhood conditions, access to food, all of those things. And so for me, when I think about racial trauma, it is a health problem. It's a public health problem and an issue that must be addressed across multiple levels, because it touches multiple levels, and the roots of racism are within the individual level, they're at the community level, they're at the society level, in addition to the different institutions that are within our society. And because it's something that has been going on for hundreds of years, it's not just one solution that's going to be a cure-all. And there are different ways that we have to attack this problem and to work together to heal people from this and to help them to heal themselves. So I'll stop there, but those are some of my initial views, and I look forward to discussing this topic more with you all tonight.
Reverend Cavanis, welcome.
Hello.
Can please share your views regarding racial trauma?
Sure. So again, thank you for this opportunity to be a part of this amazing panel tonight. And I'm the Reverend Carolyn Cavanis. I pastor Bethel AME Church of Ardmore on the main line. And one of the pieces that, and why I appreciate this conversation, particularly from a faith perspective, is from the vantage point that many times I think we're just glossing over things and not really going deep about really the reality that we face, and also certainly the burden and the the toil that it puts on us, the labor it puts on us, and not being honest about that. And then which I appreciated, State Rep, the strategies on how in which we can address and to call it forward. And so from the context that I am in, which I believe I would call somewhat of a geographical racial trauma, is that there's this notion that because I am not in an urban area, then I am not if you will, I'm not, my life is so much better. And so I have spent the 8 years that I've been in this congregation to say, there are, and we're just glossing over, and that we're not really dealing with really what the impact of this moment or being in this space. Although I'm not in an urban setting, there still is the reality of discrimination. There still is the reality that although I'm in this different zip code, that children are still having to navigate or still being judged upon their skin color. Forget about if they truly, are able to perform, right? The skin color is the defining moment. So the other piece to that, as a congregation, we don't mind talking about it and being open and honest about our pain and what we're feeling. And I say this often to the congregation: it's okay to tell God how you feel. It's okay to pour it out. It's okay to be upset and to be mad, but you can't stay there. There are ways in which you move from pain and not allowing it to go to paralysis, but rather, what is it that I learned from it, or what are some strategies for moving forward? So that has been, kind of, and I think it certainly is an aggregation of some of what the other panelists have shared already, but it's helping people just to notice, like even going through these past 2 years, even as a clergy person, I've said, Carolyn, you're not okay. Like, to be burying people and shepherding people through this moment, there's no way that, look, you have to really go deep, and taking some time to really process all that you've had to endure. And, so yeah, I'll stop there.
Well, Reverend Cavanis, this is perfect segue into the second question. So I'm going to stay with you for this one. Because you interact with people, not only in your congregation, but people in the community, tell us how racial trauma presents itself in the position you hold and the people you work with.
Sure. So one is definitely generational. And so there's a rhetoric that continues to be passed down. So this was the experience of, let's say, a grandmother within, let's say, a school district here. And so then the daughter's son has a similar, and then it gets passed down. And so at some point, there becomes a conversation that has to be had about how do we interrupt that narrative. Okay. The second piece is that because as a community, we haven't been open and honest about the pain, it's having to step back and say, can I just call out to you what's really going on here? And taking time to process. So that has also been, that's been also very interesting walk to walk with people. And I think also it also has come up in opportunities we've been doing some work with Harvard College around collecting narratives of community members around community garden. We have a big community garden program. And it's been a direct but indirect way to talk about how people feel about where they are and how they arrived in this space and what have been. So that also has been, I think it's also a point of catharsis too, like getting it out and then being able to process and then becoming, well, how did you, or how have you been maintaining, or what have been your strategies? So let's say being resilient in this space that wants you, but doesn't want you, right? And this notion of belonging. So that's what I would say be some of the ways in which it's been called out and calling forth.
Okay, State Representative Curry, please tell us how racial trauma presents itself in the position you hold and the people you work with and also interact with, because you're also out in the community.
Absolutely. So I like what Reverend said about belonging. That's a big part of the DEI space that I think is often overlooked. So when you hear the words DEI, of course, that's diversity, equity, and inclusion. But we often forget the B. And the B is the part where, particularly as a Black woman, and you can see on the screen, I'm a light-skinned Black woman. I'll just talk very honestly and candidly about my own experiences. It's been interesting going along in spaces where I was educated in very white institutions. I came here from Baltimore, Maryland. I attended St. Joseph's University back in the early 90s. So it was not diverse then, and it is not diverse now. And then moving through work spaces, and now here where I am today, we can talk about the House of Representatives, and I can give you some statistics. The House of Representatives has 9 Black women who are representing the entire Commonwealth of Pennsylvania. And I can give you another fact that there are no Black or brown senators in the state. And so that just gives you, I see some faces, wow. Yeah, there are 9 of us. So I'm brand new in the space. I feel respected as I walk through the halls. I feel welcomed as I work in my new space. Of course, here in Upper Darby and Lansdowne, East Lansdowne, Milbourne, and Yaden, where I proudly represent, we have one of the most diverse legislative districts in the Commonwealth. So I feel pretty welcome and at home within my own district on a regular basis. But we know that there are racial traumas even within a diverse population, because folks really just can't grasp other people's cultures, other people's way of doing things and how things go. And I know from knowing Jennifer and working with Child Guidance, and I know some other folks over there at Child Guidance, it's a space. I'm also on the Children and Youth, proudly been placed on Children and Youth Committee. And, one of the things that I always ask in that space for anybody who comes up through a policy hearing or who is testifying about their organizations is I ask, where is their commitment and their dedication to diversity, equity, and inclusion? And please give me the numbers where you're serving Black and brown children and what that looks like in your organizations. And so when I think about the space that I currently work in, I think it's an amazing space to be able to push through the lack of inclusion that we've seen in the Commonwealth, and to be able to speak loudly about how important it is to be inclusive versus exclusive, as we've seen right on the floor in the last few weeks. And so, we can talk about race, but we can also talk about gender. We can talk about gender, and we can also talk about sexual orientation. These are all things in my mind that when we talk about racial trauma, they come together because they're spaces that are often excluded, spaces that are often put out to the side or pushed away. And so in my space, yes, as being one of the proud Black female legislators, I want to see more of us in the space. I have an Asian counterpart, a colleague on the floor with me. I want to see a non-binary person on the floor with me. I want to see different people that are representing on that floor. And so until that happens, yes, it's difficult. We have to fight differently. We have to make people see things differently and why we might not take a vote for something that feels exclusive, because as a Black woman, there has been exclusion. We have been excluded. And so anything else that comes across the floor that feels like that to me will never get my vote, because we have to have that belonging and that sense of inclusion when we are talking about protecting legislative practices for all people.
Thank you. Judge Stroman, the same question. And being in the court system, I guess you have all sorts of interactions with people, both internally and externally. So please tell us how racial trauma presents itself in your position, including the people you work with and interact with. You're muted.
Okay, I'm sorry. I work in Newcastle, Delaware. I'm originally from Philadelphia, very different locations. I went to school at Temple and then the Penn. And so neither location was extremely diverse. However, Temple's located in a very a community that has high African-American community. And so it's gentrifying somewhat now, but it's still a difference. Newcastle County is a different place. It has about 600,000 people. about maybe 30% are African American or consider themselves African American. In the court system on a daily basis, I would say about 70% of our defendants are African American. And it's not just one particular court, it's all the courts. Some of them are better than others, but between 70 and 80% of every defendant that we see on a daily basis is African American. You talked about a sense of belonging. I feel that we see they don't feel they do belong. There is no belonging. So they're constantly seeking a way to belong, and many people have given up. In some communities, there's conversations about generational wealth. In our communities, is generational poverty, and there is no escaping from it. The school systems have failed them. Wilmington schools were divided up in the early 70s because there was an issue concerning, despite Delaware being one of the first states that really adopted Brown v. Board of Education, they failed to do it in reality. And so now they bust the kids out of Wilmington, which is primarily African American, and send them into the suburban parts of the county. When that happens, they are once again, they're seeing their counterparts who live in nicer houses, cleaner communities, and better equipped to handle the day-to-day of academics. So then they drop out, and once again, they have no opportunities to move forward in their lives. Someone mentioned how the grandparents, they come in, they know the parents, and there's group after group after group, child after child, and there's no getting better. So there's no sense of belonging. The police officers treat the minorities differently. And I see it on a daily basis. I see two little boys, exact same, fighting in school. What the Black little boy will get arrested, the white boy won't. So when we have the videos that come out now, they're not surprising to us in the court system. We see it on a daily basis. We have pictures of it. We see how it is, unfortunately, it is not just the white police officers. There's a shift in the mindset of the African-American officers as well, which further alienates or further traumatizes, in some ways, traumatizes more of the community. Because now even the Black officers are not kind to me. I really don't have a place. I really don't have a chance.
Okay, Ms. Graham, can you answer the same question for us?
So I'm in the nursing profession. So, racism in nursing for me visually started early. I got my undergraduate degree at LaSalle University. So, it was not that many African Americans in the program. And then the ones that were, every semester you would go by, people would trickle out. So, you would wonder why that was the case. So then when I graduated, enter into the healthcare system, which is very racial, I saw differences in treatment of, patients. African-American patients would get one treatment and Caucasian patients would get another. And I couldn't understand, because we all take oaths, no matter if you're a physician, a nurse, for beneficence, do no harm, non-malfeasance. You want to, make sure patients are okay. So that experience was different, especially when you're supposed to be trying to care for someone. When I became a provider, it became very evident to me that patients weren't being educated properly. We have a lot of these disease processes that are going on, like high blood pressure, diabetes. And, you see providers, they're not compliant. They don't, they're not taking their meds. But in the same token, the way you're trying to educate and patient teach is not reaching that patient. We say the word equity, and that's a big thing. My nonprofit has that in its name as well. But when we're talking about equity, sometimes it doesn't look like what may be, politically correct. To create that equity, we may need more diverse providers. We need to make a way to make sure that we have providers that look like patients, so that we can rebuild that trust, so that they can, come to the office and keep their appointment. Or like the physician has stated, you'll get people talking about eating healthy and really, handing out pamphlets. But when you have food deserts, or when you're looking at Maslow's hierarchy of needs, and, you want to worry about medicine or eating, this is reality for people. And so if you don't understand that situation or really educate yourself on that, because let's be clear, that's not in the textbooks in school. If you're not committed to that, then when you are dealing with your patient, your biases are coming through, and it's not beneficial for the patient or the provider. Healthcare really needs some help. You have maternal rates of African Americans, no matter what education level they have, lower than that. The rates of positive maternal outcomes are lower for African American women, no matter what education status that they come from. So that speaks volumes. We looked at, 2 doctors during the pandemic who passed away because they weren't heard. And I find that a lot in primary care, that, it'll be a patient that comes in and says, my wrist's been hurting for 2 years. And you get an MRI, they have a torn tendon. So, learning to really communicate with patients, educate them properly, that's where I see a lot of lack. And I also see the mental health factor. Mental health is big in the African American community, with those generational traumas and personal traumas and that mistrust. We don't open up. We don't seek mental health care all the time. But again, are you going to be open with those personal issues and personal feelings with people that may not look like you, or be able to understand that experience? So, I'm treating primary care, but my whole session may be talking to somebody about some mental health issues that's going on, because I'm somebody that they feel like they can trust. So, those are some of the ways that it's presented in my field.
Okay, Ms. Arnold, same question.
So as I had mentioned earlier, like in the work that I do in addressing health disparities, racial trauma definitely presents its form in the form of health disparities, and just seeing those differences in the burden of disease, injuries, violence, and even opportunities to be able to live a healthy lifestyle. And so we tend to see that these differences are within socially disadvantaged populations. But when it comes to the Black community, again, all of these differences that we're seeing are definitely rooted within racism and those differences and inequities within the social determinants. And so that's something that now I think is being discussed a little bit more within the context of healthcare. And Davida just mentioned some of that, like in terms of when patients are seeking care, sometimes the medication adherence may be something that the physician is talking with them about, but there are all of these other barriers to them even being able to get the medication, number one, or being able to take it due to other concerns and issues that they may be dealing with that may be more importance to them in terms of having enough food to eat, or having to go to work and may not have time to go out to the pharmacy to get their medications and things like that. So all of these different issues are definitely multi-layered. And so in the work that I do, a lot of the focus is on translating different research findings into practices and policies to address health disparities, and really working with stakeholders across these different sectors to prevent and address the effects of trauma specifically. And in the work that I do, I tend to focus on more of community settings. So I tend to work with churches as well as schools to address trauma, not only through evidence-based approaches, which are considered to be like research-based approaches, but also kind of taking that Sankofa approach to use some of the traditional practices and cultural practices that we have within our own community to address some of these concerns. So for instance, there have been times where I was working with teams to implement evidence-based interventions for chronic disease prevention, and really focusing on like diabetes prevention, for instance. And when we're having group sessions where we're trying to talk to people about eating healthy or engaging in physical activity to improve their current condition and to help to better manage it, instead of us, focusing on some of those evidence-based strategies, we had to have discussions around stress and having discussions around people saying that I don't even have affordable places to get food in my community, or I don't have safe places to exercise, or I can't afford a gym membership. And so sometimes these different recommendations are coming out from federal agencies such as the National Institutes of Health or the Centers for Disease Control and Prevention. And they're coming at it from an approach of you're the problem because you have this certain condition, without really taking into account the full context of people's conditions and really taking that holistic approach to look at the entire person and the whole person and not just their diagnosis or their condition. And so before we can even sometimes talk about the recommendations for how many fruits and vegetables you should be eating in a day, or how much minutes of exercise should you be getting, we have to take a step back and even ask people, what are your typical eating patterns? Like, what does a typical meal look like for you? And even asking very simple questions like that can tell you a lot about the different daily experiences that people are having. And so in many of those times, we have to kind of take that approach of not going into it, of just telling people what they need to do to improve their health, but having more of an understanding of what are the obstacles that are getting in the way of them living a healthy lifestyle, or managing their diabetes, or managing their hypertension, or even managing depression and anxiety, which are things that we don't talk about as much. And those mental health conditions were also things that really came up a lot, not only in schools when I was working with children and adolescents, but also in working with adults within clinical and non-clinical settings, where they mentioned that sometimes, they feel worried about things that are not just their health, but they're worrying about, are their lights going to be turned off? They're worrying about their children or their grandchildren. Sometimes we have families that are multi-generational living together and trying to stretch a dollar very far. And so all of these different things go into how they're approaching health, and also the different issues that are contributing to the health conditions that they are facing. And so it really does take that time to just get to know people and what they're going through. And then to also give an example of some of the work that I do around food justice in working with grassroots organizations such as the Black Church Food Security Network, in which we really take that approach of understanding that food security and food insecurity is not an individual problem, but this is something that is also rooted within racism, and how different communities have been designed to have less access to healthy foods, and how different communities, especially Black communities, are experiencing food apartheid, in which all of these things were by design of having more fast food restaurants located in these areas, and having certain grocery stores that may not even have fresh food on a regular basis. And so as opposed to taking the approach of an individual approach to food security by saying, well, let's just give you some more food because you're experiencing food insecurity, let's take a community-based approach, as well as more of a cultural approach of community gardening, which is something that our ancestors used to do. Like even prior to experiencing slavery, we created agricultural systems within various tribes and cultures and communities within Africa. And we really created how to, cultivate certain plants, best practices for gardening, and all of that. And we also have, now we have evidence of various studies that have actually documented how community gardening not only addresses food insecurity, but it can also help to provide mental health benefits. It provides physical health benefits through people even engaging in the physical activity of working in the garden. It also has those social benefits of being able to work together, to grow food together, to be able to harvest the food, to cook it together, share recipes, all of that. So even community gardening in and of itself is a form of healing, not only for racial trauma, but a form of healing our bodies just in general, like in dealing with some of these things that we're seeing around not having as much access to affordable fresh foods, and really being able to work across Black farmers, Black churches, and Black communities to share practices for gardening and working together to grow our own food and have more of that sustainability within our communities and addressing food apartheid from that community-based approach, as opposed to it coming from more of a charity model that we see in a lot of places where they're giving food away, and which is nothing wrong with giving the food away to people who need it, but that shouldn't just be the end all be all. And it can be coupled with more empowering approaches of also teaching people how to garden, or connecting them with different local farms or local gardens where they can get fresh produce at an affordable price or for free and things like that. So I'll stop there, but yes, that's how it manifests in some of the work that I do.
Okay, Reverend Cavanis, do you see a way forward to heal? And in your opinion, who gets involved?
So there is a way forward. I feel so like our church this year, we adopted the theme, the year of hope and healing. And so we're being very intentional. One of the pieces we noticed that we needed a grief support group. And so just, way in which to help people work through, and only certain loss of loved ones, but also just loss of a sense of, affirmation, or how the world has just changed. I mean, we have made a lot of concessions. The second piece is that we also know that there is a limit as to how far we can go with this work. And so we've had to connect with, the medical professionals to help guide us in this work, because we can only go but so far. The third thing we've done, in fact, Dr. Arnold introduced this to us, was something called a wellness wheel. And so looking at all the different prisms, if you will, and sectors of ourselves, and what are the areas that I need to be strengthened in, and then providing some direct ways and concrete ways of connecting back. So these have just been, it's possible. I think it's forcing us to move from rhetoric or like, oh, wow, to here are practical ways. And then also we as an institution having to also model the behavior that we want people who are connecting to us. So for example, like on Sunday, when I was closing up worship, I said, Monday, I know where the pastor's going to be. I'm going to be taking some rest because we just came out of Holy Week. Because I said, it's a lot that has just happened. And then we're asking people to walk the walk of what Jesus and all, which is cool, but that's also traumatizing too on some level, right? So having to literally, or we want you to go take a walk, or like we have a prayer line every morning at 7 a.m. And I say, please go outside, get some vitamin D, even if you walk out and come back, that's cool. And then we have a big gardening program, which Dr. Arnold's a part of. So just these tactical ways that I think people are needing and yearning for. It's like, take Post-it notes. You go to the refrigerator a lot. I know you're in your bathroom a lot. Put it up there. Say you love yourself. Say you can make it. Say you can, but also having, and I really appreciate this conversation, because it's connecting us to folks to help us to, especially we who are major stakeholders, on how do we navigate this work and how do we help people. And we just can't just say, oh, you're going to get over it. That day is over. Like we have to move past cliches and actually, especially for many of our populations where mental health has always been stigma, right? Where we're going to a therapist. Like, and I tell people, I go see a therapist. They're like, what? Like, yeah, like I need somebody to talk to too. So I'm not ashamed about it, so that we have to change and for what, and we don't even know what's to come. We're still, so.
Okay, State Representative Curry, do you see a way forward to heal? And in your opinion, who gets involved?
Thank you, Luanda. So yes, I think that like I said earlier, when I had first began talking, I feel like I don't want to be negative, but I feel like racism and racial trauma will live on forever. That's an opinion that I have, because I know that the only way that we can clear it out is that if everyone clears it out. But if we have a majority that really works towards it, and we know that in education helps to really move things forward. So there's really 6 ways, and looking at who would be involved. We all have to be involved. No one has a way out. But I know that in working in different parts of the Commonwealth, there are people who don't have to. It's not something that they even have to think about. So because there's so much likeness around them, they don't have to make an effort to have friends that have difference, or to look at treating patients that have difference, or to look at serving constituents that have difference. There are some people in certain parts of this Commonwealth, in this country, that will never have to do that. But the people that need to be involved is everyone. And I always, in my own training and teaching and coaching, would talk to people about allyship and disruptors. We absolutely need allies. When I look at the faces on this Zoom, I'm like, okay, they're allies here, because otherwise they would not be spending this evening on a Zoom talking about racial trauma and healing. But allyship is not enough. Allyship is the tip of the iceberg. And I know you all from child guidance know that iceberg, you know, that image that we see, the iceberg where it has all those nice friendly things on the top. But we know that an iceberg, it goes way deep in the ocean. And there's so much rooted in the bottom of the iceberg. And so we absolutely need allyship. I feel like I'm preaching. We absolutely need allyship, but we must have disruptors. We must have disruptors. And what I mean by being a disruptor is there's 6 things. You have to read and educate yourself about what's going on. One of the books that I tell people to look at all the time if they want to touch the surface of racial justice is called White Supremacy and Me. And get the workbook, because you work through it and you really identify, even brown people, Black and brown people can do the work to see where they have opinions and where they can do things differently. You have to reflect on what education in this area means to be a disruptor versus an ally. You have to remember, because we can't, it's just like another part of white supremacy is color blindness. Any of us on the line ever say, oh, I don't see color. Well, that's a form of racism. And that pulls the trauma out even deeper and further. And so you have to reflect and remember about the pain and the trauma that is actually taking place, maybe that morning, maybe that afternoon. You have to take risks on challenging those who are performing and indulging themselves in racist behaviors. And it's exhausting. It's exhausting on a daily basis, but you have to take those risks to be a disruptor, to say that is unacceptable. We are not standing for poor conditions in schools that are racist. We're not standing for underfunded populations, marginalized people. We have to take risk in that. And then the last 2 is rejection. Rejection of any type of behavior that's racist, a joke, in action. Neighborhood, not participating in neighborhood cleanups is a form of rejection. We have to be able to clean up our areas and to be able to live in spaces where we feel comfortable, safe, and whole. And lastly, we have to relationship build. We have to build relationships with people who we might not look at on a regular basis, who we might not even want to talk to. But we have to make sure that we are intentional, as the Reverend said, about being relational, about helping people to understand that this racial trauma only heals if we're all in it together. It sounds cliche-ish, but it's the truth. That's what we have to do to get involved. And Dr. Arnold, I just want to say this before I stop talking. I really wanted to hear about your space in academia when she said what was going on, because I know I was a professor for many years and I was like, oh man, she's not talking about academia. She's not talking about being a woman of color in academia, because we know that that's a space that suffers. So maybe we can talk offline. I would love to hear what your experiences are at the University of Pennsylvania. And I've talked enough, but we all have to come together, and Luana, that's everyone. Thank you.
Thank you. Judge Stroman, the same question. Who gets involved with the healing, and do you see a way forward?
I believe everyone has to get involved. I wanted to mimic, I guess, in some ways what the state rep said concerning people who say they don't see color. When you don't see color, you don't see me. It's just that basic. When, and people tend to say trying to mean no harm, whatever that might mean. But what they're really saying is they're not respecting my day-to-day trauma, the microaggressions that I face on a daily basis. It's the little things. It's the clerks that don't want to do your paperwork until they did someone else's. Or if you make a mistake, they'll help the other judges, but they won't help you because they want to see you fail, and they don't feel you should have a right at the table. But if we don't have seats at the table, that means we're on the table. That means we're getting eaten. And unfortunately, a lot of people in our communities are getting eaten on a daily basis. So it'll take everyone to help. We can't stand by and say, okay, I have it okay. Meanwhile, our brethren don't. They're sitting there and they don't have enough, whether it's food, mental health, or just legal services. We have to do better as a community to help those who and pull those up, because each one of us are standing on the shoulders of somebody. And if we don't, as a group, start looking down, say, okay, this person needs help. In a lot of communities, we unfortunately, it's a horrible tease, but they get, they live 10 people in a house and they're on the store together. Well, that's how they help each other up. So that the next generation, they'll have their own. And we have to start doing that. We have to start creating an environment where we give help to the people. We give, we write the connections. It's not in Delaware, for instance, we don't run for judge. We're appointed. My sister's a judge in Philly, and so I know the whole process that she had to go through to become a judge in Philadelphia. I didn't have to do any of that because we're appointed. Some ways is better, but in a lot of ways is worse, because what that says is if you don't know the right people, if you don't have the right connections, you will never become a judge in Delaware, or it'll take you a long time. Unfortunately, people in the African American, we don't have those connections. We don't have those ties. And when we do, we keep it to ourselves as opposed to bringing other people along and helping them along. And we have to do better about that and give recommendations. And if we have a great job, I work in a court, and not to use myself, I need to bring one of those kids from Wilmington in to see what I do so that they can see, okay, I might be in poverty now, but there is hope for me. And each one of us, the only time we tend to do that, Christmas time, we're going to buy all the kids a toy. We're going to go to the church, get a card off the end, we're going to adopt a kid. But these kids need much more than a toy at Christmas. They need a day-to-day support system. And we can do that. We are powerful enough to do that. Our dollars are strong enough to do that, but we don't. And so, yes, I think we can do it, but it's necessary for us to do it. And I'm hoping as people become more aware that we'll take the time out to say, what can I do, as opposed to waiting for someone else to do it for us.
Dr. Arnold, same thing for you. Do you see a way forward to heal? And in your opinion, who gets involved?
Yes, I definitely see a way forward for healing at these various levels. And I think that it is going to take all of us, as Representative Curry mentioned. And it's not something that is just up to one particular population or one sector to address, because of the fact that it is a very multi-layered and very deeply rooted issue. And so at the individual level, I think that some of the strategies that we can do include promoting the individual and group therapy for people to be able to kind of process certain experiences that they have been through with a mental health professional, as well as educating people about racial trauma and the effects of racial trauma. Because the reality is that some people think that racial trauma only impacts people of color, but it does manifest in other ways that it negatively affects us as a society. So even when it comes to the health disparities that I mentioned, that shows up in taxpayers' dollars in terms of the high instances of people using emergency rooms, for instance, for certain conditions, or having to be on various forms of medication and having to, pay for this through either public insurance, private insurance, et cetera. But all of that goes back to economics at the end of the day. And it's something that we all have to deal with in one way or another. And so it's better for us to deal with it on the front end, coming at it at an approach of prevention, and from that standpoint of us being in this all together, as opposed to saying, well, that's for those people over there, like they're the ones dealing with it in their community and that's their problem. No, this is a societal issue and problem. And it is going to be something that's going to continue to manifest in different ways and to impact all of us. So it has to be something that is a collective concern. And then I think that additional things we can do is offer certain spaces for people to be able to come together to discuss their experiences with racial trauma. So one of those ways is through emotional emancipation circles, which is something that can be done within a workplace. It can be done within a church, within a school. It can be done in any setting where you can just bring people together within a room to actually sit in a circle, and for each person to be able to describe their experiences with racial trauma. And then in some of the circles that I've been a part of, we would also have affirmations on the wall from various ancestors, whether it's family ancestors, national, international ancestors, and just words of encouragement and reminding us who we are and where we truly came from beyond just slavery, because our history doesn't start there. And just really having that time to be able to come together with people who have been in similar situations, to be able to really talk freely. And even as you mentioned, Representative Curry, the situations that I've been through in academia, I actually attended my very first emotional emancipation circle when I was a PhD student at a predominantly white institution in Maryland, because I got my PhD from Johns Hopkins Bloomberg School of Public Health, which is the #1 school of public health in the world. But there's also still a lot of historical racism that's there. There's also a lot of current and contemporary instances of racism, not only at the interpersonal level, but really rooted within the institution. I was the only Black student in my program, and I was in a program specifically for health and public policy and really addressing health disparities and promoting health equity, but I'm the only one who looks like me in that particular program. And having that stress of being in various classes where we're talking about health problems and health issues that Black people are facing, and then all the students are looking at me as if, I'm the representative for everyone. And my story is very unique in terms of growing up on a very small farm in South Carolina and really seeing firsthand the impacts of racial trauma and unaddressed trauma on the mental health and physical health of people in my personal family, in my community, and really having that deep desire to want to address health and to improve the health of my people, and not having a lot of examples of successful Black people or Black women in particular who had been educated, who had fought for justice in different ways and been able to really use their work as an instrument to be able to fight for social justice and change, and just trying to navigate all of that. And so I know that when we think about all of the experiences, we each have a story. And so having those times to be able to come together in spaces such as emotional emancipation circles, to talk about our story, to process things we've gone through, and to share strategies of things that may have been helpful to deal with that stress in the different environments in which we're navigating on a daily basis. And even like Reverend Kavanaugh mentioned earlier, us promoting rest. We don't, like, in this society where we're highly stressed, it's a very individualized society where they're constantly saying you need to be on your hustle and your grind all the time. And sometimes taking rest is not something that is even promoted, but that is a form of healing and being able to just be kind to yourself and to be honest with yourself when you do need to take a break, when you do need to take a step back. We're in this time where, like, even when it comes to emails, where like people are constantly like replying to emails within seconds or within minutes. Like we all have busy days and things that are going on And it's okay that if you need to take a break from the email, if you need to take a break from, doing certain things to take care of your own mental and emotional health. So even promoting self-care practices as well is included in that toolbox for us being able to really promote healing, not only for racial trauma, but just for trauma in general. And for also just taking that time to take care of ourselves and to ask ourselves, what do we need? What is it that I'm dealing with right now? What is it that that I need to help me to feel better emotionally or to support my health? Is it that I can take a walk while I'm in a meeting where I don't necessarily need to be on camera, and I can go outside and feel that sunlight on my skin, feel the fresh air, and to just be able to do something for yourself? And I do talks and things like that as well on self-care specifically, because that's an area where I'm very passionate. And I think that in various contexts, no matter what level of income you're at, self-care is something that can always be improved, and something that we don't talk about enough of. How can we take care of ourselves, and how can we lean on one another to figure out ways to share strategies for taking care of ourselves, and to make that time, whether it's a minute to take some deep breaths or 5 minutes to take a walk or whatever it is. But there are various things that we can do in that area. And then I also think that at the family level, really having honest conversations, because I think that there still is a lot of hurt and things that people are carrying and holding on to that they don't want to share with family members out of shame, out of guilt, out of embarrassment, whatever those emotions may be. And that's even something that I went through with my parents, because they grew up during the Jim Crow era in South Carolina. And my mom was born in '54 when Brown versus Board of Education was passed, but didn't go to an integrated school until like the mid '70s or something like that. So like, there are a lot of things and experiences that she did. She shared some of it with me when I was growing up as a protection mechanism, but some things she didn't tell me until I was an adult. So we do have to have those honest conversations even within families, so that we're not holding on to things, because we do also have studies of how holding on to that hurt contributes to high blood pressure. Holding on to that contributes to obesity. It contributes to depression and anxiety. All of these things are connected. So it's really important for us to even have that healing within our family, to talk about what is our true family origin. What, if we don't know the origin, how can we find out the origin? What are some of those stories that have been passed down? There are many people who grew up in Philly where their family didn't start out in Philly, and they may have migrated here from the South. So having those conversations about what our family members went through, that's also a form of healing. And then at that community level, really leaning on institutions such as churches, schools, places where we spend most of our time to really figure out how we can implement healing practices within these spaces. And so I mentioned earlier that I've worked with trauma-informed interventions within schools to really focus on teaching kids mindfulness, talking to them about the effects of trauma, what that does to the mind, what it does to the body, how to recognize those signs, and then also how to ask for help, because that's something that we didn't grow up always knowing, how to ask for help when we're dealing or processing instances of racism, or we may have saw something in the media that made us feel a certain type of way, but we're like, well, who do I talk to about this when you're at school or when you're at church or when you're at work? So really being able to have those open and honest conversations in places where we're spending most of our time, and really fostering that that trauma-informed approach to be able to understand that we all have different situations that we may have gone through, and it's okay to talk about it. And it's okay if you need a moment to meet with a supervisor or to meet with a therapist that may be on site, or either to also create more of those partnerships where we are partnering with mental health professionals within these various spaces to be able to provide additional help when it is needed. And then, of course, we had already mentioned some of the things like at the institutional levels in terms of, training various clinicians, or training teachers who may be working with students, or training different supervisors or administrators in different workplaces around what racial trauma is, what that looks like. how we can implement certain practices so that we're not re-traumatizing people. And then within, at the highest like policy level, whether that's a local policy, state policy, federal policy, really examining some of these policies that have led to these different discriminatory practices. There may be some things that are still in place that can be examined and assessed to figure out how we can dismantle some of these racist policies and practices that are in place at those various levels, and to really engage stakeholders, including policymakers at these different levels, so that we can have these open and honest conversations about what has been happening, how these different policies have led to the differences that we see, like even in terms of like the availability of food in certain areas, or the differences in housing rates, housing conditions, neighborhood conditions, the availability of things that are in certain neighborhoods that can promote health versus other neighborhoods where they may not have as many health promoting or health supporting resources, and just really figuring out how we can work together to rectify some of these things. And I think that just overall, it really is about the partnerships, and it's about us collaborating and coming together to have these conversations, because we are kind of in our own lanes and in our own sectors. And so how can we really share what's going on within the work that we do, and then figure out how we can have more of these conversations where we're not just talking about what the racial trauma is, but how it manifests in our work, and then how can we actually implement some strategies and then measure the success of the strategies that are being implemented to see how we can continue moving forward in a sustainable way.
Okay, we're kind of running short on time, but I want to get to Ms. Graham. Do you see a way forward for us to heal? And I'm going to add one more thing onto that. How do you see mental health organizations like Child Guidance getting involved?
So first, I've been holding it. I wanted to tell Dr. Arnold that when she mentioned that whole person thing, that's the nursing model. I always say that the nursing model is the best model to help create equity. So I wanted to shout out the nurses real quick. But I definitely see that we can come to a place of healing. We have to hope so, right? If not, then wow. So everybody is involved. Everyone is a stakeholder. But the key thing I wanted to add to that is that the way everybody participates in involvement may look different. I don't want people to think, if I'm not, speaking up at work, if I see something that's not right out loud, or, and stopping it right there, that I'm lacking. No, you may be the type of person that needs to go speak to somebody, to the side, and let them know that, I didn't appreciate what X, Y, and Z said. Or people can, be politically active, maybe call, it's a bill in place, or, to be aware that with their involvement in making it better may look different for that individual, and that's okay. And so how can mental health organizations, get involved to help things? So, training events, diversifying your staff, especially when, maybe the staff is more Caucasian and you may be dealing more with minorities, really having, extensive training and addressing personal biases in those sessions, and listening to maybe guest speakers like in this scenario, and how they feel, and hearing what's going on internally with them, to help you relate to dealing with patients. Faith-based initiatives, that is a very big thing, something with mental health. So being able to make those partnerships with, Black churches, being able to make partnerships with after school programs like Boys and Girls Club, where children are at, Those are the things that you want to make commitments with. A lot of times, sororities, fraternities, those are places that you can reach out to for additional help, to give you educated professionals that could be able to be speakers. So, building those networks, and being able to have various individuals to come and speak and give their ideas.
Okay, Reverend Cavanis, how do you see mental health organizations like Child Guidance get involved?
I think what we're doing right now, and I totally agree with Tavita around just being out there, providing resources, certainly finding direct and indirect ways to certainly connect with the key influencers and stakeholders, I think is key. And just being out there as much as possible. And I think also that in this moment, people don't really know what to ask for sometimes. So that's why I talk about the indirect but direct way. So it might be at, a karaoke event where somehow you find an interesting way to talk about mental health. Just these interesting, because also because there's so much of a stigma or it's taboo. And so we're still having to tread, lightly. I think also to show, and the faces that are out there are important. So like, I'll use this as an example. We're doing an event for Juneteenth, and we're going to have like the suicide task force for the Montgomery County come out. And I was very upfront, it would be helpful if you're able to have a staff person of color who can staff that event. Because it removes, that's a great, ally's fine, and I'm not knocking that. But if we can be sure that's best possible, because, people being able to connect, so.
Judge Stroman, the same question. How do you see organizations like Child Guidance get involved?
I think it's important that organizations such as Child Guidance are in the community. It's nice to have a nice location, but it's really important, especially since mental health awareness and struggles with mental health is not as prevalent acknowledgement of the mental health struggles is not as prevalent within our community. So if you're there, the people get to see you, they get to know you, you're part of the community, so that when they are struggling, they will go to you and seek help. Because if you're situated in a location and all the way at University City and wherever, and but that's not in the heart of North Philly or West Philly where the help is needed. It's really important to become an integral part of that community. So it's not us and them any longer, it's we. And once you can establish that we factor, organizations like Child Guidance can be really helpful.
Okay, Dr. Arnold, same question. How do you see organizations like Child Guidance get involved?
I think that the esteemed panelists have already mentioned everything I was going to say. So I'll just do like a really brief summary. I definitely agree that continuing to provide services within the community and providing that continuum of services across home, school, as well as various community settings, such as the community recreational centers, boys and girls clubs, like a YMCA, things like that. And really working as well with faith-based institutions such as churches, and really just being wherever people are and being able to like meet people where they are, and providing services in a way that it kind of encourages people to take advantage of those services, but then also lowering the bar for what it takes for people to receive services. So sometimes this financial barriers, sometimes it's just that people don't know that those services are available. So kind of like increasing the visibility of what you all offer or can offer to individuals, families, and institutions. And then also offering culturally responsive services that are rooted within traditional practices, and doing things such as like the emotional emancipation circles that I mentioned earlier, or promoting things like yoga, community gardening, like kind of taking a little bit, stepping outside that traditional box of like traditional healthcare services, and really bringing together these different practices in a way that you are addressing the holistic needs of people and not just whatever their condition or diagnosis is. And so I'll leave it there, but those are some of the ways that I think that that programs and organizations such as child guidance services can help.
And State Representative Curry, how do you see mental health organizations like Child Guidance getting involved?
I think organizations like Child Guidance are already involved. I think it's the way the involvement takes place. I think continuing to be at the top level with the board of directors, with investors, with practices and policies around hiring, and really including that DEIB investment in everything that's done when thinking about making decisions about how getting into certain communities, you know, really having that holistic approach and being able to think about things from the side of being equitable, of being inclusive, you know, making sure that when you are seeking someone to be on the board to make decisions at the higher levels and to make the policies within child guidance, that people that look like the people you're serving are involved. That's very important. And I think a lot of times, most of us on this line, from what I've heard so far, are highly educated. I think we go in and we talk to the grassroots folks that are really having the issues, that are really the ones who are involved in the day-to-day, and the ones that have those stories that aren't often brought to the table, and how they're brought to the table. Because we can't make it a charity situation where we're like, oh, let's bring this poor Black family to the table. We have to integrate every piece, and that grassroots effort is seen in organizations who really have a commitment to it. It's not lip jack. It's not back talk. It's not sliding back into a space where you're like, oh, we tried and it just didn't happen. It is that full effort every day. And so organizations that have a commitment to serving folks that are marginalized or poor or have mental health issues that can't be addressed in the traditional way, we need to put ourselves in those positions to bring the other people up and to the table where we wouldn't necessarily think we can. Salary caps, positioning, all of those spaces that help to really see what's going on inside a community.
Oh, that was great. I thank you all for responding to these questions. I don't think we have any questions in the chat, and we're sort of running out of time. So I want to just say, Child Guidance and I would like to thank you for being our wonderful panelists, and thank you for, you know, responding this evening to this wonderful topic and with all your comments. And thank the people who also participated as an audience this evening. And our organizational goal is to host discussions related to diversity, equity, and inclusion throughout the year. And we hope you will join us once again. So thank you and good night.
Thank you guys so much.
Good night.
Thank you.